The electronic medical record is a system that we use to house all patient information, and it allows for a one-stop shop for anything about the patient or care that has been provided to the patient.
It has all of our orders, patients' histories, their labs, their scans, psychosocial information, financial information, all wrapped into one package.
Biosimilars are a challenge for a lot of health systems, and that's because different payers require different products.
Meaning that providers prescribing this medication, they would like you to use a specific brand. And so we were seeing a delay in care because different insurances were requiring different biosimilars, and we really knew there were some options that were available from the EMR, and asked a question, is there an easier way to do this?
When we first approached this problem, there wasn't a standard solution in our electronic medical record. So we brought together some really smart minds on our IT team and said, what options do we have to improve this process? In the new state, now we know which product that insurance company prefers, and so instead of having to send it back, resend it to the insurance company, get approval, we pick the right product from the very start and avoid all of those extra steps. Our clinical pharmacists love this process because our goal is always to provide the safest, most efficient, and effective care. And we want our clinical pharmacists talking to patients, educating patients, making sure they're receiving the right medications at the right time from a clinical standpoint. And when they're burdened with administrative tasks like changing products on treatment plans, it takes away from their time directly caring for the patient.
We started with one drug and saw really a remarkable difference. Our turnaround time went from 12 days to really just a little bit over 4 days. And so it really made an impactful difference, especially for an individual that's starting treatment. The sooner that we can get them into that chair.
They're also seeing improved co-payments because the cost of care is less when we're able to use a biosimilar frequently compared to a reference product. Since then, we've been able to share this with a lot of other organizations, and we've seen more and more places that are saying, yes, I want to do the same thing. This makes sense for our patients.
I'm tickled that we can really display the great work that happens at the James and in the pharmacy department. To kind of be able to be a part of that recognition is something special.
I can't tell you how much time and effort was put into the development of this from our prior authorization team, our IT team, our pharmacists, and even our faculty in some cases. And so just really excited for their hard work to be recognized and excited to share this so that other patients can benefit across the country.